A very warm welcome to the marketplace for today, where today's special edition we are crossing over to the Accra Digital Center for the opening of the JoyBusiness Health and Wellness Trade Show. Currently ongoing is the question and answer session.
In here alone, it's not going to be sustainable. So export is a way, and export to big markets. If you are just exporting paracetamol to the European Union, you're talking about a lot of money, or to the US. So nothing fanciful. Just do the simple ABC and ensure that we support them to be world-class and to really compete at the world-class level.
Okay, thanks very much. Professor Kosa spoke about some interesting concepts, and they don't sound like stuff you need to have studied rocket science to implement. I'd like to bring in a private sector operator in the health insurance space, just to really learn from your experience. There's talk of the private sector stepping up to participate. Should we be looking at a targeted approach for the national health insurance scheme, and how accessible is private sector insurance for us? And that's Mr. Philip Osu-Yeboah. You're with Apex Health, and I'd like to hear your thoughts.
Hello?
Yeah, speak up, it's on.
Okay. Private health insurance is very accessible, just like the national health insurance. The law that established national health insurance also established the private mutual and the private commercial. Now, with private commercial, you must first be a registered entity of the national health insurance. Then you add, because it either complements, duplicate, or supplement the benefits that the national health insurance cover. What private commercial health insurance has done is to go beyond what the national health insurance covers, give you more in terms of amenities and benefits, superiority, give you both proprietary innovators to medications as well as comfort. And therefore, it is very accessible and works much more efficiently because of the regulators' involvement as well as the stakeholder being the providers, getting whatever they need right on time, and also the insurance educating their members, unlike what is willing within the national health insurance.
See, there's an interesting reality in there, and I don't know in your case, but typically private health insurance becomes visible when you're in formal employment. As an individual, I can go and register with the NHIS. Why is that access not as universal in terms of registration to Joe Blogg, who can pay you your premium but doesn't work for a company?
We are looking at the risk involved. You know, for the national health insurance, it's a social policy intervention from the government. Just as Professor Akosa said the other one, people actually do not pay premiums at all. With the private health insurance, particularly with the private commercial, it is operated for profit based upon market principles. So the benefits actually is equated to the premiums you pay. It's an equation of value. We also need large numbers to reduce the risk involved. And individuals walking in would have to certify themselves of so many conditions, medical underwriting, before they can actually be accepted onto the scheme, because unlike the NHIS, it is not a social policy intervention, but run solely for profit, based on market principles. So that is the challenge, whereby individuals cannot enroll on, unlike now that many of the private health insurance now are willing to go into that formal sector or informal sector.
Okay. Now, Prof, I don't know what your thoughts are regarding how we find a common ground between the way the private sector runs the health insurance systems that they do in comparison to how the NHIS is run. Because he seems to suggest that it's open, but not really open to everyone.
Well, I mean, if it is for profit, then of course it cannot be open to everyone.
Yeah.
But I think the basic agreement is that, and I think he alluded to that before they can register you, you should be registered with the mutual health insurance. So in a sense, that can play the role of a top-up mechanism. So, for example, and I think that short of saying that we are accrediting different types of facilities so that those who are registered with us can go to these particular facilities, you can say, fine, you have private health insurance, you go to your district hospital, and whatever, if you are admitted, we can give you the most convenient ward, sort of single ward or whatever, so that, you get the comfort, that is the addition of the private health insurance. But that is ability to pay. So anybody who cannot, you certainly don't go there. But if you can, then I would say no matter where you are, you have national health insurance, go to private, get your private registered, and for convenience, if you go to a district hospital, everything that private hospital, the district hospital can do for you, they can add on and you get a much better experience at the district hospital. I mean, that is how the two can, should I say, merge, imperceptibly. But otherwise, then for most people who cannot afford, of course, that is not where you go. The private mutual is almost a mix, a blend between the social national health insurance and the private commercial. So a group of people come together and you have your private mutual. And one person's risk is equalized by another person's, so you can run in that kind of space. But as far as the private commercial is concerned, it's purely affordability.
Okay. I think we have Madame Rebecca Koto in our midst. That's right. Let's get a microphone to Madame Rebecca. So you're with the NHIS. Some interesting thoughts have been put across, and I would not hesitate to say quite a number of us think that that glass is half full. There's still opportunities for us to do more. Can we see, what will we need to do to see some improvement in how the NHIS is administered?
I'm sorry, I'm not here in the capacity. I'm not representing NHIS, even though I work there. I'm here as a student. I'm a PhD student, and I'm here to ask questions and learn from other people.
So let's learn together. So you can give us some thoughts without your official capacity. I think that's the essence of
listening to that portion.
Okay. That's all right, never mind. Okay, so I have a question on leveraging technology, and I know Dr. Kumar Forson talked extensively about that.
I have a question on that.
Oh, you do? Please, fire away then. Yes.
I want to find out, it looks as if we are doing a lot in the technology side when it comes to health, but we don't have standards. By standards, I mean that I know that Professor Dodu's place has standard. For example, I know that you are using ISO EC 1 for the FDP. But when it comes to our devices, our healthcare facilities, we don't seem to have a doctrine, a standard. We have to have a standard, otherwise it looks as if we are all doing different things. You go here and somebody is doing this, you go here and somebody is doing this. If you compare the way we do our things to other places, you see that they have a standard to follow. If you go to a place like, let's say, Canada, when it comes to protecting health information, they follow the HL7 system. You can follow the ISOs 2700. There's so many systems, but we don't have any doctrine to follow, and so people use different software here, different this thing here. I think that in your challenges, I expected to see that we don't have a standard. It is one of the basic problems that we have in the health sector. We have to have a standard to follow, otherwise we would be wasting our time in trying to leverage technology in whatever we are doing. Thank you.
Okay, I'll take your response in a moment. I think Mr. Michael Bohr, who's a senior nursing officer with the Ministry of Health, is here. He has a question. You'd wanted to respond. Okay, all right. Let's get a microphone to him, but Dr. Kuma Forsin, you can start, and then we'll hear from Mr. Bohr in a moment.
So I agree with you that standards is a problem. That's the first thing. You saw I alluded to it maybe a bit indirectly through my challenge of data protection. So that's very important. But I want to tell you that it's not all the systems that do not have standards. There are, if you go to the Ghana Health Service, they have on display HIPAA. If you're talking about enforcing, that's a different issue. But there are standards that are advised that systems run with. Now, this is for data protection, like I said, but also because we want to have the advantage of big data. Like for drugs, for example, we know that if we are able to get information on maybe 5 million people on a drug they are taking for hypertension, we'll be able to tell which drugs work better for Africans or Ghanaians as compared to those in Europe. So the question goes beyond just standards for standards' sake, but there is an interest, an inherent interest, because in Europe they are going towards precision medicine, where they can tell what dosages and combinations may work for particular people because they have the data. So I agree with you, but I can also confidently tell you that a number of the systems do have high security levels. Maybe you are talking about how it has to be enforced, and that's where we can improve. We can improve on.
Okay, Mr. Bohr.
Okay, thank you very much. What I would want to add is that it's not as if entirely we don't have standards. We do, because standard boards, FDA, they are all they are all players of the health sector, and then as much as they have standards, we could probably say that yes, to an extent we have. But when we come to Ghana Health Service too, there are standard documents, guidelines that are supposed to even guide clinicians and other people as to what to do when it comes to healthcare delivery. For example, the standard treatment guideline, it's one document that spells out how certain cases ought to be managed. Even with national health insurance, there are documents that spells out how even facilities ought to be accredited. So I would say that when it comes to issues of enforcement, yes, then we would have to look at it. But to a larger extent, there are documents. And I wouldn't say that there is nothing to do. There is still room for improvement.
Okay. Thanks very much, Mr. Bohr. Professor Akosa wants to add a point.
Can I just add that, one of the most difficult areas is calibration of equipment. This is work that Ghana Standards Authority does. But I bet that a lot of our facilities do not calibrate their equipment year on year. It should be possible that before you re-register your facility, you should show evidence of proper calibration. On just the light side, you go anywhere and you get your blood pressure taken. Now, whether the blood pressure reading is correct or not, you're going to spend the rest of your life taking treatment based on that. Now, if that calibration is wrong, for example, then, you've had it. So it is important that these are some of the minimum things that we can do. And I think Ghana Standards Authority has always been ready, and I know the challenges they've had trying to get our facilities to calibrate the equipment.
Well, I think Professor Akosa said what I was going to say, but let me just, let's make this clear to Ghanaians. Business as usual is not going to move us to Ghana beyond aid. So my big brother, Professor Akosa, has made a point that we've had challenges, but our view as Ghana Standards Authority is that our job is to protect consumers and make trade move. So whether the facilities are ready or not, we would insist. And if we insist and they resist, we would inform Ghanaians. It's about time we take everything serious. Why do we need standards in any enterprise? They build trust. The language of business is standards. So if you say 1 kilogram is 1 kilogram wherever you go, the moment you have no standards, your trading is witchcraft. In the absence of standards, In the absence of measurements, business is just witchcraft. Because I send you something and say it's 1 gram, and it can be 10 grams or 0 grams. So the time for standards is now. Ghana has standards. What we have not done is to make Ghanaians aware of the standards, and to enforce the standards. We actually have an Electronic Transactions Act for anything you do in e-health. We have a Data Protection Act, which demands that all of us keeping data on more than one human being should register with a data registrar. How many of us have done that? I'm sure Joy FM probably keeps a lot of data in any form on health, on patients. Are they registered with the data registrar?
Every single entity under multimedia group is registered.
Praise the Lord. But then let's make this clear. Business as usual is not going to lead us to Ghana beyond aid. We have to insist that commerce in Ghana, and that includes measurement in healthcare, because there's only one facility which is ISO certified for laboratory services, which means that the rest of the laboratory services you have, Professor Kosa just said that if you take your blood pressure in 10 places and you get 10 different results, then we have an issue. So there are big issues, but it doesn't start by trying to wrap people the nice way up. It starts by saying that the health of every Ghanaian is critical. And if you are going to be measured with an equipment which has not been calibrated, your health is at risk. And that will not be allowed to occur. So standards will be enforced. That is a pledge.
All right. Let's hear from Dr. Patrick Abuaji, who is the Director for Family Health at the Ghana Health Service. Okay, let's just borrow this one.
Yeah, thank you, Prof. I wasn't going to say anything until the standards came in, but I'm just making an appeal to Prof. Dodo, and I'm sure Professor Kusa knows a bit of the problems we've had. I think we are also equally interested in standards, calibrating our BPs and all our equipment, but we are in the same family. And if we can't afford to pay that, that becomes an issue. And I think it is something that, because we are all interested, we need to continue dialoguing to ensure that we are able to do that for Ghanaians. Thank you.
Well, it's a good point you raise. It leads me to a question that I wanted to table for every panel member to offer some ideas. In Dr. Kumar Forson's presentation, he talked about the need for intersectorial collaboration. I'd like you all to suggest how we can make that happen, and which institution should lead this, because health planning is just as important as, it's actually integral to your development planning. Should it be the Ministry of Health that's leading? Should it be the NDPC? Where should it sit? I'm going to start with you, Professor Akosa.
Well, Ishra, I used to be a commissioner at NDPC, and I was there because of my health expertise, not for any other reason. And NDPC in this country has the mandate for intersectoral collaboration. That is enshrined in their law. So yes, I think NDPC can do that. But since we all resigned, I don't think that new commissioners have been appointed.
Why did you resign?
Oh, we delivered the 40-year development plan to government, and we felt that having done that, a new government should be given the space to, choose their own commissioners and, look at the document that we had presented. We didn't think that we needed to encumber, you understand? So we all decided that once we finish and we deliver the document, and that is what we did. We told the president that all of us have decided to resign so that he has the space to choose his own commissioners. But I think that up to now, I don't know that new commissioners are being appointed to begin to do that work. So if NDPC is not ready, then I still think that the Ministry of Health should begin, and I've asked that we should have a health dialogue, because there are a lot of people who have entered the health space who do not, should I say, contribute, but create a lot of problems for the people of this Ghana country. And I said, we as a country, we have a lot of gullible people. I'll tell a very interesting story. I have a niece living in Kumasi, in a compound house in Kumasi. Somebody, a mobile hawker of herbal drugs goes there, and everybody in that household buys some. I think my niece had too many problems, so she took hers that night. The following morning, she was dead. And you don't know who that mobile hawker is. So, that's it. Family members are called, we've gone and buried. That's it. Science is delivered. But I think that it is important that we have that health dialogue to begin to discuss. There's so many people who for chronic diseases are keeping people. Hey, prayers may be important, but for Christ's sake, let them see people who have been trained to, look after them before, and come and add the prayers. Don't keep them in prayer camps. And go to Central Region, it's a wash with prayer camps. And people are dying there, and they smuggle them into mortuaries. And the mortuary facilities bill clearly indicates that anybody should not be accepted there until the person has been properly certified dead in a public facility. But do they do that? Private collusion, it doesn't happen.
Thank you very much, Prof. Professor Dodi.
I would just like to answer the issue about the Ghana Health Service working with the GSA. I can actually tell you that the Director General, Dr. Nsiansari, has approached us. We've had discussions, and I fully support your view that government to government should ensure that we get the right things done, and the money should not be the barrier. We can always find ways of, when you owe your brother, it's not a problem. Coming to the intersectoral dialogue, who should lead it? I'm actually going to flatter multimedia and say that you should convene it. And let me tell you why. It's about time we demystify health. Health is not just about doctors, pharmacists, and nurses. Create a platform. Let us discuss everything from treatment choices, and let it be objective, open, and transparent. At the end of the day, it should be about evidence, about science, about technology, and about where we are going. If you leave it to doctors again, we'll just come and use our titles and intimidate you. Let it be led by the non-medical sector.
All right, thank you. Okay. Go on, Mr. Sabler.
Sure. About intersectorial dialogue. I agree with Professor Dodi that it should be led by a non-health person. But I think the Ministry of Health should take...
It's on. Just closer to you.
I think the Ministry of Health should take the lead because they are responsible for the health status of this country and everything about health. From where I see it, if we have a good electronic health record in this country, it will be easy for me to find out, okay, which drugs have been used, what are the safety issues of this drug, and et cetera, et cetera. If you have patient record, we have database of diseases, it's easy to go, all the information that comes from elsewhere, they go into this database and find out, okay, are the drugs that the people are using, are they safe? Who are the people who are at risk of taking this medication? If we have databases that can easily do that, it makes life easy for everybody. We may come to you to report adverse events, but organized databases help a lot to find out safety issues about medication. So if the Minister of Health lead this, it will be better and it will be good for this country.
Okay, final thoughts from Dr. Elvis Kumar-Forson.
Yes, I just forgot one more thing. When they mentioned about the BP equipment, I personally know management of one of the biggest BP brands. I won't mention. It's a foreign brand in Ghana now. They're under a lot of pressure to get their equipment calibrated in Ghana. So it's happening. It's coming slowly. So they didn't even want any visibility, and they are currently, as I speak, they are getting that done. And on your question, I think I would also go towards the strategy rather than who should be in charge. And I think the strategy should be as low on the ladder as possible, at the district level, at the assembly level. When we get them involved, then we'll be able to ensure standards. So I think that will be my contribution. And the way we do that is to demystify health. It's not in rocket science when it comes to the common things. Yeah.
Okay, thanks very much. Mr. Singh, you want to add your voice?
Yeah, just replying to Professor Dodu's, multimedia has been working on public awareness on health through our various platforms, whether it's on TV, radio, online. You have seen a lot of our documentaries which was produced. Just last week, Women in Battle, if you have seen, about how women are giving birth at prayer camps and how childs are dying. And there was another one that we did with regards to Kung Fu Anoche hospital, the situation at the baby mother and baby unit and all that. Then we built a new unit and things like that. So we will continue to do that. But we will do that to a certain extent that we can create awareness. But like you were saying that, you know, at the end of the day, it's a lower level, whether it's opinion leaders, whether it's leaders of I would not say it's like a district, you know, it's like they need to continue to amplify the message, because it's appalling. I mean, it's not necessarily the issue is among the rural and the suburban area, but surprisingly, it's also within the urban areas. And I have a colleague, not long ago, we lost him, and before he actually passed away, instead of taking him to the medical practitioner, they said, no, take him to the prayers camp. Only when they realized at the prayer camp that he cannot be saved, then okay, now take him to the hospital. By the time we lost him along the way. So it was unfortunate, but it's something that we'll continue to do in multimedia, and we will we'll work on it, and perhaps more. Okay. But at the same time, I think we need the authorities to also further advocacy and you know, improve on that as well. Thank you.
Absolutely. Thanks very much, Santo. Okay, so final question or comment.
Hi, good afternoon. My name is... Good afternoon. My name is Christiana Addison, and I represent a health and nutrition company called Salad Master GB Health Solution. And my question is in reference to a statement Professor Dodu just made, that health is not just about doctors, pharmacists, or nurses. And coming from the industry that I am in, a lot of the conversation now has really been around doctors, pharmacists, and nurses. And the truth is, normally when you're diagnosed with any kind of illness, aside from prescribing medicine, you are also encouraged to watch your diet, what you eat, exercise, and all of that. And there's also a direct link between a change in our current lifestyle and an increase in a lot of the lifestyle diseases that we are seeing. I think you'll agree with that. So my main question is that, given that we are at a health and wellness forum, I would like to know really your thoughts on alternative medicine, especially using food, because food is in abundance, and I think it's probably a lot cheaper than medicine, and it's medicine. Food is medicine. But I want to know about your thoughts on food and where it sits in this $8 trillion industry, and how it really complements the medical industry as we know it as well.
Brilliant question.
Thank you very much for a brilliant question. I think you've summarized everything we've been saying today. The Ghanaians as a people are not health conscious. I would have expected this health and wellness fair to have attracted thousands of people. If it had been a beauty fair, beauty pageant, a musical show, it would have been heavily, attended. Ghanaians are extremely illiterate when it comes to our healthcare. We do not take responsibility for our healthcare. We are religious, and yet I keep reminding Ghanaians, those who are of the Christian faith, that if you read the Bible, it says that, I wish above all things that you are in good health. So your health is your responsibility. And to add to it, health is not just doctors, pharmacists, or nurses. It's about your lifestyle. It's about where you walk. It's about the air you breathe. It's about the buildings you have. It's about the money in your pocket, and so on. And food plays a key part in health. Bad food leads to obesity and all the things that we know about. Good food helps. But let's face it, the health and nutrition sector, if well managed, is a blockbuster. It's going to make you live longer, but it's going to make you healthier, and it's going to generate wealth. So I fully support you. I think we have not even looked at that angle, but Ghana is blessed with products with huge health-giving potentials. They are safe, they are useful, but they have not been harnessed. So let the conversation begin.
All right, thanks very much. This one, if Professor Bedua Kosa doesn't speak, we won't leave. Very, very important.
Madam, I wholeheartedly agree with you.
Please raise the microphone.
I wholeheartedly agree with you. Nutrition is key. But let me say that there is a lot of new evidence in nutrition that somehow we in Ghana have decided to shut our mind and, and ears to all the new evidence that is out there. I have gone round, I am saying that tropical oils are good for you. That is what the whole world used. And to think that the first classical heart attack happened in America in 1923. So before that, what were they using for their food? It was pork lard, beef tallows, and tropical oils. Today, with the advent of vegetable oils, the food industry have come to tell us that it is the vegetable oils, the corn oil, the sunflower oil, the canola oil, those are the ones that are good. But those started in 1910. And that led to the first heart attack. So I say, look, the evidence is there. Palm oil has the same structure as olive oil. If you can say olive oil is good, I don't see why you can bastardize palm oil. Corn oil, coconut oil, palm kernel oil, and shea butter. These are the oils that we in Ghana should be eating. But we are allowing oils that do not even show what vegetable they come from. It's just vegetable oil. And somehow we allow it into this country. And these, a lot of them are gutter oil. People collect oils that have been used and fried for whatever, collect them, take them to the lab, they go and bleach them and deodorize them and pack them in drums and bring them to Africa. And those are what we call the trans fats. And those are the ones that do us damage. So for Christ's sake, let's get back to brass, basic level. Tropical oils, fat in milk, breast milk, is the same as the fat in coconut oil, palm kernel oil. So why can we sit down and say those oils are bad? Thank you.
Thank you very much. Now, if you just tuned in, you're listening to the opening ceremony of the Mating Joy Business Health and Wellness trade show at the Accra Digital Center. And I'd like to acknowledge the partners who made this possible. Safe Doctor, your mobile hospital. Apex Health Insurance, your preferred health insurer. Ernest Chemist, providing quality and affordable medicine. Interstar Eye Clinic and Laser Center. And all of this is endorsed by the Ministry of Health and the Food and Drugs Authority. There's a final question, and then we can end it.
Yes, my name is Gidel Fiabo from Neo Crystal Health Services Limited. My question goes to the rep from FDA. Did I hear you say that you have a software that detects a fake drug? If yes, I don't know whether there's something that a software can do with regards to expired drugs, because we are in the age where people have a way of altering the expiring date. Then with in connection with people calling you, telling you we have ABCD drug, we have taken it, it's not working for us. I don't know whether you have considered working with healthcare service facilities where we can have posters of awareness of fake drug and expired drugs, so that we can reach out to direct people, other than having those contact numbers in your offices or go to forum and you mention it. I'm not sure any of us have taken the numbers. Thank you.
All right, thank you. Mr. Sabla?
Yeah, thank you very much for very good questions. I think the first question was, do we have software that detects substandard drugs? Expired drugs? No, we do not have any software that detects expired drugs. For every medicine that we register, it's a requirement that there should be expiry dates on the products. And that's a basic requirement. Any medicine without the expiry dates is not a registered medicine. So we don't have a software that will look at the drug and say, oh, it will expire on this date. No, there's no software for that purpose. The second one is, do we work with health facilities awareness programs? I think during my presentation, I highlighted on the fact that what we do is that we go to health facilities telling health workers that they should report on safety issues with their medications. And we also started that with patients. We had an advert on radio, on TV, and on social media. That ran for about 3 months in the latter part of 2016. There are plans to relaunch that. So these are the awareness programs. In addition to this program, we have posters that you might have seen. I don't know how many of you here have seen the posters in a community pharmacy saying, "I'm your pharmacist, report side effects to me." Anybody here have seen that before?
Yeah, seen it.
Somebody, okay, at least somebody has seen it. So these are the posters that we have. We have a lot more posters than what the pharmacy wants. We have some for healthcare facilities. We have some for directed at patients that you can find in the community. So we do have posters for awareness creation. We plan to do a lot more as we move on. Thank you.
No. Thank you very much. I'd like to, unfortunately, end here and say a big thank you to Professor Ajimambedu Akosa, Professor Alex Dodu, Mr. George Sabla, and Dr. Elvis Kumar Forsin for your presentations and your time for the Q&A as well. Thank you very much. Let's give them a round of applause. You may please take your seats. Thank you. Now, we were unable to be graced by the presence of the Deputy Minister of Health, but she made sure that her message and her goodwill was extended through a representative in the person of the Director for Family Health at the Ghana Health Service, Dr. Patrick Abuaje. Let's welcome him with a round of applause as he speaks to us on behalf of the Deputy Minister of Health. I only had one person applauding. Thank you.
Thank you very much, Inshra. Mr. Chair, Chief Operating Officer, Radio and Digital Media, Multimedia, the group head, which I understand is out there, all our partners, friends of the media, colleagues, and unfortunately my own former boss, Professor Akusan, has just left, but I still acknowledge them. Prof. Dodo, Dr. Kumar, for this excellent presentation. I bring you greetings from the Deputy Minister of Health. It was actually her desire, that's Honorable Tina Mensah, to participate, not just be at this meeting, but also participate in this important event. But due to other equally important assignments, she could not make it here. So she has asked me to read her speech. So I'm going to go strictly by her speech. And so everything you hear is from Honorable Tina Benson. My name is Dr. Patrick Abuaje. I'm the Director of Family Health Division, responsible for nutrition, health promotion, reproductive and child health in the Ghana Health Service. So this is from Mrs. Mensah. It gives me great pleasure and indeed an honor to deliver this opening statement on the occasion of Joy Business Health and Wellness Trade Show. The theme of the show, leveraging research and technology for sustainable access and affordability, remains very relevant to the health sector as we actively subscribe to the United Nations Sustainable Development Goals, SDG 3. Specifically, Target 3.8, which seeks to achieve universal health coverage, including financial risk protection, access to good quality essential healthcare services, access to safe, effective, and quality affordable essential medicines and vaccines for all by the year 2030. As a sector responsible for ensuring healthy lives and promoting well-being for all ages, this trade show affords us the opportunity to explore various means by which we can collectively work together as partners in health to ensure a sustainable availability of equitable, quality, safe, affordable health services to all Ghanaians and all people living in Ghana. Mr. Chairman, the benefits of research and medical technology to health service delivery in general can never be overemphasized. Medical research can generate imperative information regarding disease trends and risk factors, outcomes of treatment or public health interventions, functional abilities, pattern of care, healthcare costs, and use. Areas in medical technology like biotechnology, pharmaceuticals, information technology, and development of medical devices and equipment, and many others have all made significant contribution to improving the health of people all around the world. Mr. Chair, ladies and gentlemen, notwithstanding, the cost of medical technology is not declining, despite the increasing use. The World Health Organization has hinted that hundreds of billions of dollars are spent on research and development into new or improved health products and processes, ranging from medicines to diagnostics each year, which have direct implications on health service delivery costs. Lower middle-income countries around the world are faced with the challenge of scarce resource envelope, thereby forcing them to allocate more of these resources to health service delivery and very little to medical research and technology. This therefore calls for a need to leverage medical research and technology to ensure that we achieve sustainable, accessible, affordable, and quality healthcare delivery for all. Distinguished ladies and gentlemen, the government of Ghana has over the years shown its commitment towards ensuring sustainable, equitable, effective, affordable, and safe delivery to all. The Ministry of Health in 2016 reviewed the national quality policy to ensure rational use of access to safe, effective, quality, and affordable pharmaceutical medicines for the people of Ghana. Additionally, the President of Ghana, His Excellency Nana Addo Dankwa Akufo-Addo, launched the National Antimicrobial Resistance Policy and National Action Plan to help deal with the phenomenon of antimicrobial resistance, a global public health problem which has affected both humans, animals, plants, and the environment. The National Essential Medicine List was also reviewed in 2017 to be in line with WHO standards so as to better address public health needs of Ghana. Similarly, MOH also introduced the National Healthcare Quality Strategy of 2016 to help refocus the national efforts and further strengthen institutional arrangements within the health system to better deliver on strategic and operational interventions in quality of care and patient safety. The ministry is also ensuring nearing the final stages of reviewing the national health policy, which also places enormous emphasis on the achievement of universal health coverage through the use of disease prevention, health promotion, as well as access to affordable quality health services. Distinguished ladies and gentlemen, the Ministry of Health through the Ghana Health Service is currently implementing the 5-year Health Research Agenda 2015-2019, which is aimed at bridging the gaps, geographical access to health services, and ensure sustainable financing for healthcare delivery and financial protection for the poor. It also seeks to improve efficiency in government and the management of health systems in Ghana, as well as enhance the national capacity for the attainment of the SDGs and sustain the gains. Mr. Chairman, MOH is working very hard with support from development partners and to develop an overarching national research policy for the health sector. As I bring my speech to a close, please permit me to congratulate the multimedia group for making this day a reality. Let me also salute the effort of distinguished health professionals and other key stakeholders in health here present for the commitment shown over the years in ensuring the quality and affordable health services to the people of Ghana. Mr. Chairman, I wish to end by encouraging us all partners in the health to continue to work harmoniously in our engagement so as to help achieve the single goal of ensuring that all people living in Ghana attain the highest level of cost-effective in the range of health services that we already have in Ghana. This one is my own. On the middle of June 11th, we are having a maternal newborn nutrition conference, and we want to ensure that a similar forum is open for all our partners to share our best practices and also confront the challenges we have in reducing maternal and newborn and child mortality. Mr. Chairman, on this note, I declare the 2018 Joy Business Health and Wellness Trade Show officially open. Thank you, and God bless you all.
Thank you very much, Dr. Patrick Abwaji, for that speech. And thank you all very much. We've been live on Joy 99.7 FM and also on the Joy News channel on Multi-TV, also on DSTV channel 421. At this juncture, I'd like to say a big thank you to all our sponsors and partners who made this possible. Safe Doctor, your mobile hospital, Apex Health Insurance, your preferred health insurer, NS Chemist, providing quality and affordable medicines, Interstar Eye Clinic and Laser Center, and thank you to the Ministry of Health and the Food and Drugs Authority for the endorsement. We will now say goodbye for now and move over to the hall where we have the exhibition for the cutting of the tape. The Joy Business Health and Wellness Trade Show is duly starting, and we may all move out now. Thank you all very much. God bless you.